to autism. And just to clarify, I tend to use the word autism synonymously with other terms like autism spectrum disorder and autism spectrum condition. When I say autism, I'm really referring to the kind of full breadth, if you like, of autistic spectrum disorders. So after that brief introduction, I'm going to go on and talk about the gender ratio in autism, and it's going to lead me on to this question of is there a diagnostic bias against females? We'll then go on to have a think about characteristics of females of autism, and that will be really me talking about some aspects of the female autism phenotype. And then I'm going to aim to link some of that work to diagnostic practices, to have a think about ways in which the female autism phenotype might help us understand diagnostic biases against females. And then, depending on how much time there is, because I'd like to leave plenty of time for questions, I'll just briefly go over some thoughts on future directions in this field. Okay, so what is autism? Well, the difficult answer, if you like, the uncomfortable answer to that question is we don't actually know what autism is, in the sense that there is some mysterious underlying atypicality of brain structure and function that is autism, and that hasn't yet been identified. You know, we have no biomarker for autism. We can't see it. We can't directly observe it, you know, in MRI scans or whatever. And that's a bit of a problem, of course, because we'd like to identify people who have autism in order to give them help, to offer them support, and also to further scientific research, to do research with them so that we can understand more about autism. So what do? How do we, if you like, identify autism when actually the thing itself, what a medic might call the underlying entity or underlying atypicality of autism, what do we do given the fact we can't actually directly observe it? Well, we do what people do in these situations, which is instead of saying we're going to observe the thing itself, we're going to look for its manifestations. Yeah, so we say, okay, we can't directly observe autism, but let's have an agreement on how it manifests in terms of observable signs and symptoms. And there's a pretty strong consensus about which observable signs and symptoms signify the presence of an underlying autism. And that consensus are our diagnostic criteria, as they're written down in DSM-5. What that consensus says is that autistic symptoms kind of come in two types, the social and the non-social. So the social elements of autistic symptoms are to do with social reciprocity and social communication. The non-social are to do with repetitive and restricted interests and behaviours, and indeed atypical kind of sensory processing. Over the last 20 years or so, a consensus has grown that autism is a dimensional condition as opposed to a categorical one, which is to say that autism isn't an either-or state, you know, either you have autism or you don't. Rather, it represents the extreme of a trait distribution that extends throughout the whole population, that we're all on somewhere. And that's what's illustrated by this slide. And that there's a sort of semi-arbitrary threshold or cut point below which we say somebody doesn't have autism, and above which we say they do have autism, sort of labelled as having the clinical condition of autism. Autism is highly heritable, although it is also influenced by the environment, as is becoming increasingly clear. It occurs in about 1% of the population. I mean, the trouble is with any slide about the prevalence rate of autism, it very quickly becomes outdated because, of course, estimates go up and up the whole time. So I suspect actually that the consensus around autism prevalence at the moment is probably more like 1.5% than 1%. It's associated with intellectual disability in a third to a half of cases, certainly by current diagnostic conventions, and it's almost always associated with additional neurodevelopmental, cognitive, behavioural and or emotional difficulties, co-occurring conditions, and so on. Okay, so that was my very brief introduction to autism. And now I'm going to ask, what is the gender ratio in autism? And this was in fact a question that one of my students on our clinical psychology doctorate at UCL recently asked and addressed using a meta-analysis. So by combining the results of multiple studies to come up with a kind of overarching estimate of the male to female ratio in autism. And what she did was she systematically identified every epidemiological study of autism since DSM-4 came in. So the idea was to identify those studies that had gone out into the general population and attempted to work out how common autism is. And so she pulled the data from these studies in order to address this question of, when you identify a group of people with autism, what's the male to female ratio? And she pulled together 54 studies that had the rather impressive combined sample size of nearly, collectively, 14 million participants. And she found, if you combine the studies from all of these studies, there were about 4 males for every female with an autism diagnosis. And this is in line with what it says in DSM-5 and with common estimates of the male to female ratio in autism. Now, Rachel also found another interesting thing in these data, which was not just that there was a 4-to-1 male to female ratio, but that there was a lot of variability between studies. So you had some studies that found only 2 males for every female with autism, and other studies that found 8 or 9 males for every female with autism. So Rachel set about trying to understand this variability. Why was it that some studies found more females, whilst others found, relatively speaking, fewer females, as a way to try and gain insights into whether there are biases against females with autism. And I'm going to tell you about one particular investigation she did here that I think is quite telling. By the way, if you want to read this paper, it's available in the Journal of the American Academy of Child and Adolescent Psychiatry. It came out this year. The comparison that we made was between 2 types of epidemiological study. Yeah. On the one hand, you have passive case ascertainment studies. So these are studies where they go out into a population and they try and identify everybody who already has an official diagnosis of autism, be it from a clinic, from a school, from some other statutory body, but they can only identify in these studies people who have a pre-existing autism diagnosis. Can't identify people who have autism that haven't been picked up. And in those studies, we found a male to female ratio of 4.6 to 1. Yeah. However, there's another type of study amongst these epidemiological pieces of research where they used an active case ascertainment method. So here they go out into that population, but instead of just relying on finding people with a pre-existing clinical diagnosis, they search for all cases of autism within a given population. Perhaps they do that by screening and then following people up. So the important thing with this type of design is that it can pick up individuals regardless of whether or not they've already been identified as having autism by clinical services. And in those studies, we found a lower male to female ratio, 3 to 1. So effectively, we found more females in the active case ascertainment studies than the passive case ascertainment studies. And what that tells us is that there are females out there in the population who, if you go out there and you look for them and you give them a good autism assessment, they will meet diagnostic criteria for autism, but for some reason, they're not making it into the clinics. They're not picking up official diagnoses. So that's the first piece of evidence I'd like to present to you for a bias against the ascertainment of autism, against the identification of autism in females. Now, I'm now going to talk about a different way of ascertaining cases that comes up with a different male to female ratio, because I think it makes another important point about biases against autistic females. So remember I was arguing earlier that autism is a dimensional condition that represents extremely high levels of autistic traits. Now, what happens if instead of trying to identify cases by seeing whether they meet DSM-5 criteria, or DSM-4 criteria. What happens if you identify cases by saying, I'm going to sample people who have very, very high levels of autistic traits, who have high levels of social reciprocity difficulties, high levels of social communication difficulties, and have the kind of non-social sensory and flexibility characteristics of autism? Well, you find an even narrower male to female ratio. Often it's in the region of about 2 males for every female, and that's been found across a number of contexts. Now, what that implies is that there are females out there who have high levels of autistic traits, severe difficulties with social communication, with social reciprocity, high levels of inflexibility and atypical sensory processing. But for some reason, even if you give them an autism assessment, they're not scoring up. There's something about the female presentation of autistic traits that means that even if you have high levels of autistic traits, as a female, you're somewhat less likely to meet DSM-5 criteria and DSM-4 criteria than a male with equivalently high levels of autistic traits. And there's evidence to back that up from elsewhere. So Ginny Russell and her colleagues showed back in 2011 that actually higher autistic traits, more severe autistic traits, are required by females to receive an autism diagnosis than by males. And Dworzinski and colleagues at the Institute of Psychiatry in London had a sort of equivalent finding where they found that more co-occurring difficulties were required by females to receive an autism diagnosis compared to males with equivalent levels of autistic traits. So let me pull that together. So I've presented evidence that we have what you might call an under-ascertainment of females of autism, in that services are missing cases and therefore missing the opportunity to give people the appropriate support in a timely fashion. And I argue that there's 2 types of bias operating here. The first is that there seems to be a bias against females actually receiving an autism assessment. And that was shown by the contrast between the 4-to-1 ratio in the passive case studies, case ascertainment studies, and the 3-to-1 ratio in the active case ascertainment studies. But there also seems to be a bias against females meeting diagnostic criteria, so that there are some females out there who have high levels of autistic traits, but compared to males with similar levels of autistic traits, they're less likely to actually fully meet autism criteria and qualify for a diagnosis. And this strikes me as a problematic situation, because the risk is that there are girls and then women out there who require support and early detection and understanding and support that can come with an autism diagnosis, but who are being denied that support. So I see this as an urgent clinical problem that we need to try and resolve and eliminate. So what is causing this under-ascertainment of females of autism? Yeah, that's, if we want to try and put it right, we need to try and understand what's driving it. And the key answer that people have put forward in the last decade or so is that there's something about the female autism presentation, the female autism phenotype, that makes girls and women on the autism spectrum less likely to receive an autism diagnosis. You know, there's something about the characteristics of autistic girls and women that is driving this under-ascertainment of females of autism. So I'd like to go on now to talk a little bit about the female autism phenotype, the characteristics of females with autism. And I'd like to just offer 2 notes of caution, or 2 kind of introductory comments before I go on to do that. The first is that I've tried to base what I'm about to say on sort of scientific findings as far as possible, because the situation we're in at the moment is that there's a lot of knowledge and wisdom out there about the female autism phenotype that comes from autistic women, autistic girls, parents, clinicians, and that's very valuable. But I would argue that you need to then go on and take that wisdom and knowledge and test it out scientifically before you can really develop an evidence base in this area. So I've tried to focus on findings that have some sort of empirical scientific support. Now, the other thing I'd like to say is that What I'm keen to stress is that whilst, as I'm going to argue, there are consistent differences between the ways in which females, autistic females present and autistic males present, these are just trends, if you like. I don't want to sort of come across like I'm a sort of, you know, almost in a sort of men are from Mars, women are from Venus way, and sort of make gross generalizations. You know, every female with autism is like this, every male with autism is like that. That's not the case. You know, you'll meet many females who show a, you know, what you might call a male typical phenotype. You'll meet males who show characteristics of the female phenotype. So when I talk about the autism female autism phenotype, please bear in mind that I'm seeking not to make generalizations about every girl and woman with autism. I'm talking more about tendencies. Okay, so the female autism phenotype, what are its characteristics? Well, one idea that's fairly well evidence-based and is commonly spoken about is that autistic females have, on average, a higher social motivation, a greater interest in the social world and in forming social relationships than autistic males. And that's something that Rachel Hiller, for example, showed it in her work in children, where for example, parents reported that their autistic daughters were more likely than equivalent males to be interested in forming friendships and in the social world. They weren't necessarily any better at maintaining those friendships, actually, but they were more interested in forming them, more motivated to that. And also Alex Head's work in adults showed something similar, this idea that the autistic women in her sample were more motivated by friendship and more kind of actively engaged in the social world compared to the autistic men that she studied. Okay, so a second element of the female autism phenotype concerns the sort of focused interests that are a key part of autism. So, as I'm sure you know, many autistic people have a sort of tendency to become really focused on certain topics or activities, and in many ways this is one of the great strengths of autism, because of course such a focus can mean that people develop interests that give them great satisfaction, and where they develop valuable kind of expertise and skill in certain areas. So what the picture that certainly comes from clinical practice, but is gradually being attested, I would say, by the science, is that on average the focused interests of autistic females tend to be a bit more typical, a bit less strikingly autistic, if you like, and are often quite gender stereotyped compared to those of males. So those of you who perhaps know autistic girls or have worked with autistic women and girls, or are autistic women, or are a parent, might be aware that many autistic girls, for example, have a real interest in animals, and often have really quite focused, intense interests in animals, be it horses or whatever. And firstly, that's just not unusual for a young girl or a young person to be really into animals. So it's not strikingly unusual, although in these cases it's often pursued with a real intensity. And secondly, that could almost be described as quite a gender typical interest for a girl to have. Many girls, and probably slightly more on average than boys, would have an interest like that. So you could begin to see that this particular element of the female autism phenotype, that, if you like, the quality of the focused interests that are shown by females could be misleading to some diagnosticians, because it's kind of like if a kid comes to you and it's clear that they're obsessed with one particular line on the London Underground, that jumps out at you as a strikingly odd interest. If somebody comes along and they're really into horses or animals, that's a bit less striking, and you could easily miss the fact that it's actually pursued with an autistic intensity. Okay, I'm now going to talk about the third element of the female autism phenotype, which concerns the co-occurring difficulties that so often are found amongst autistic people. So what we find is that many people with autism experience an increased risk of suffering from mental health difficulties. And the picture that's beginning to emerge is that pattern of risk, that constellation of risk, is somewhat distinct between males and females. Males on the autism spectrum are more vulnerable to internalizing difficulties, behavior problems. Females on the autism spectrum, especially as they approach adolescence and adulthood, are more vulnerable to anxiety and depression, so-called internalizing difficulties, and, as I'm about to go on and talk at a bit more length, eating problems. And I suppose I'd just like to make an observation, which is that all of these elements of the female autism phenotype I've talked about so far actually probably reflect just gender differences in the general population. Which is interesting, isn't it? And that's certainly a topic for researchers in this area to be mindful of, is to try and tease apart where aspects of the female autism phenotype simply reflect general population gender differences and where they are specific to autism. But anyway, I'd like to go on and talk now about the relationship between autism and eating disorders amongst girls and women. And I'm going to focus in particular on anorexia nervosa. So anorexia is diagnosed when a person becomes significantly underweight due to restricted eating, reflecting an intense fear of putting on weight and a distorted body image. Onset is typically in adolescence and early adulthood, and it affects over 10 females to every male. And actually, there's a slight typo on that slide. I should have written there's high rates of mortality, not morbidity. Unfortunately, anorexia nervosa is often referred to as the most dangerous psychiatric condition there is, in that there are quite high rates of mortality for people who suffer from chronic anorexia nervosa. So on the surface, anorexia nervosa doesn't look like it has much to do with autism. More common in females, autism is more common in males. It's about eating, not about social capacities. Its onset is in adolescence, whereas autism has an earlier onset. But nevertheless, what has become clear, based on foundational work by people like Professor Chris Gilberg and the team at the Institute of Psychiatry, led by Kate Chanturia, is that around a quarter of women with anorexia meet criteria for autism, which is an extraordinary finding. You think that the prevalence of autism in females would be, you would expect to be no higher than about a quarter to a third of a percent generally. So to find 1 in 4 women with anorexia nervosa meeting criteria for autism is very, very striking indeed, and is obviously a finding of profound clinical importance. Now, I will say, well, actually, no, before I go on to that, I'd also like to make the point that if we think about autism dimensionally as a kind of continuous trait distribution rather than a categorical condition, we also find evidence for elevated levels of autistic traits amongst both adults and young people who have anorexia nervosa. And that's what this slide is doing. It's reporting on a meta-analysis by Heather Westwood, whose PhD I co-supervised, and who did this very, very good piece of work here. So high rates of autism traits amongst those who have anorexia nervosa, amongst women who have anorexia nervosa in particular, because all of this research has been done on women with very, very few male participants. We do need to be cautious. What we know from, particularly from this groundbreaking study, the Minnesota starvation experiment, which took place in the USA in World War II, when volunteers agreed to be starved and then renourished so that scientists could learn more about the effects of starvation and how to renourish people, partly so that they could use that knowledge for assisting people who've been in concentration camps and other people who've been starved as a result of World War II. What we found from that study is that starvation can cause you to look a little bit autistic. So the guys in this study didn't start off with any sort of social difficulties or or flexibility difficulties, but after they dropped about a quarter of their body weight, they became much less socially motivated, less interested in the social world, and also they became more inflexible, and they became more focused, or they had focused interests. It may not surprise you to hear that many of them reported focused interests around food. So we need to be cautious. There is a risk that people can overestimate rates of autism in anorexia nervosa. But nevertheless, I would say that there have now been a series of really quite rigorous studies assessing autism in populations of women who have anorexia nervosa, including ones that have assessed symptoms before the onset of the eating disorder, or that have used multimodal assessments, that have used the ADOS, and they all do converge on this figure that between a fifth and a quarter of women being treated for anorexia nervosa meet criteria for autism. So what I would conclude from that literature is that a key part of the female autism phenotype is that in females, but it would seem much less so in males, autism is a substantial risk factor for the development over adolescence of severe restricted eating difficulties. And this is an area that we're currently doing research in to try and understand more about the mechanisms whereby autism confers risk for the development of anorexia and other restricted eating difficulties. Okay, so now I'm going to go on to talk about a fourth element of the female autism phenotype, and this is, in the top right here of the slide, the greater capacity to camouflage autistic difficulties. So what do I mean by camouflage? Well, I'm talking about behaviors that mask autistic characteristics in social situations, and or the performance of behaviors that compensate for difficulties associated with autism. And this was summed up in a title of a piece of work that was done by another of my graduate students recently, that I'm going to talk a bit more about the study in a moment, but she called it "Putting on My Best Normal." And this was actually a quote from one of the participants, an autistic woman, who said that what she did was she put on her best normal. She performed what she considered to be kind of normal behaviors in order to hide, to camouflage her autism. So examples of masking. I was talking to one young woman who, as she kind of reached late childhood, early adolescence, she noticed that her stimming behaviors were attracting kind of negative attention and looked a bit odd to her peers. And so she took a decision that she would no longer stim in public. She would wait till she got home in the privacy of her own home before she could do some stimming, which she found to be a very pleasant activity. So that would be an example of masking. Compensation is more about adopting behaviors, learning new strategies and behaviors to navigate social situations and to manage some of the sort of challenges of being autistic in a neurotypical world. So again, thinking of another person I spoke to, she talked about how as she transitioned to secondary school, she became conscious, or she was increasingly conscious that she just didn't know how to behave in social situations and didn't sort of instinctively want to behave like the other girls in her class. And she decided that she was going to pick a particular girl in her class who she thought was particularly popular and admirable, and to copy that girl in how she dressed, how she used gesture, how she talked. And the autistic girl in question would go home and practice gestures in front of the mirror. And so in this way, she kind of built, if you like, a persona that she was able to use in social situations. Now, Laura Hull, the PhD student, has conducted a study into camouflaging where she recruited, I think it was between 90 and 100 autistic adults online to give her verbal data, text, if you like, in response to a series of open-ended questions about camouflaging. And then she developed this model of camouflaging. I'd like to highlight a couple of aspects of this, and I'd also point you towards Laura's paper, which is now out in in the Journal of Autism and Developmental Disorders. It's open access, so it's very accessible, and it's quite an accessible paper anyway because it has lots and lots of quotes from the participants talking about their lives and their experiences of camouflaging. So the first thing I'd like to talk about are motivations for camouflaging, and Laura identified two main themes, which was one motivation was to assimilate, if you like, to fit in, and the other was to know and be known, that it was felt to be necessary in order to, if you like, to make relationships. So one person said, camouflaging helps to survive in school and college, and it's important for keeping jobs. I want to avoid the bullying mostly, which is, I think, a bit of a sad statement, isn't it, on the environment that the neurotypical world provides for autistic people, that essentially many feel obliged to pretend not to be autistic in order to avoid literally harassment and sort of physical threats. And perhaps a more kind of positive reason for camouflaging is that someone said, it enables me to be with other people in a way that's relatively comfortable for me and for them. And indeed, some people talked about how they might camouflage at first when they're meeting somebody, and then gradually as they get to know them and trust is established, they may camouflage less and less and be able to be more themselves. Now, another thing that Laura was interested in her study of camouflaging were in the consequences of camouflaging. So one theme was that the one result of camouflaging is that it gives people a kind of inaccurate view of the capacities of autistic people that can end up actually sort of perpetuating stereotypes, if you like. People also spoke about the challenges of camouflaging, really, the stress, the anxiety, and the exhaustion of it. And then there was a sense that it can erode one's sense of authenticity and identity. If you spend a lot of time pretending to be someone else, that certainly has its sort of psychological challenges. And just to illustrate that, here are some more quotes. So what are the consequences of camouflaging? Well, this is such a common one. This is almost universal. People talk about camouflaging being exhausting. I feel the need to seek solitude so I can be myself and not have to think about how I am perceived by others. So this idea that camouflaging was exhausting and took them away from themselves. Another thing is that it can stop you getting diagnosed, of course. I went for so long without being diagnosed because I didn't know that I could pretend to be normal. And again, people talking about how it can get in the way of people receiving the right care. And here we see a quote that reflects that kind of erosion of identity that camouflaging can give rise to. Now, so far, I've talked about sort of, if you like, the cross-sectional aspects of the female autism phenotype. But of course, it is possible that there are some differences between males and females in terms of their autistic symptoms that could only be visible to us if we look longitudinally, if we think about characteristics over time. And I'd just like to briefly talk to you about some research that I've been doing with my colleagues on this. And it really is interesting to note that nobody's researched this in any depth, but intriguingly, this is an idea that's been around for a while, because actually in Hans Asperger's original paper on what he called autistic psychopathology, he said, when he's wondering why doesn't he see females in his clinic, and he muses along these lines. It could be that autistic traits in a female become evident only after puberty. We just do not know. Well, myself and some colleagues have made an initial attempt to test that idea. We're taking a dimensional approach to autism, measuring traits across the full spectrum of severity, not just in a clinical sample, but in a large general population sample called ALSPAC, which is a birth cohort study with over 7,000 people in it from the southwest of England. And we measured autistic traits using a measure called the Social Communication Disorders Checklist, which is a pretty well validated measure of the social, not the non-social, I hasten to add, but the social elements of autistic traits. And we measured these traits longitudinally at 4 time points, at 7 years, at 10 years, at 13 years, and at 16 years. And we were interested in whether there were different kind of patterns of these traits over time for girls and boys. And this is what we found. So you can see along the horizontal here, the x-axis, we have 7, 10, 13 and 16 years. And then on the vertical, the y-axis, you have an average score on the SCDC. And then the red line is males and the blue line is females. And for the males, you see a fairly flat pattern with a slight reduction from 7 to 10, but basically starting higher than the females and then fairly stable level of autistic traits across the time period from 7 to 16. Whereas in females, we see something a bit different, which is, again, we have that drop from 7 to 10 of autistic traits that are seen in the males as well. But then this rather curious phenomenon of an apparent rise in the average level of autistic traits from late childhood through to adolescence, age 16, to the extent that the females have even caught up with the males in terms of their average autism trait scores by the age of 16. So some sort of evidence in favour of Hans Asperger's original speculation that maybe in females, if you like, the onset or at least the emergence of overt and observable autistic traits in females happens around puberty. And just to sort of present those data in a slightly different way, if we think about them categorically in terms of what proportion of males and females at each age scores above the sort of clinical threshold for our measure of autistic traits, so who scores in roughly the top kind of 10% of the distribution, who therefore might warrant further investigation, you see the same pattern basically. So age 7, the boys greatly outnumber the girls in terms of the proportion who score above the threshold on our measure. By 16 years, that effect has gone, and that reflects a kind of growing proportion of females between 10 and 13 and 16 years who are being identified as having high levels of autistic traits. So early days, these are preliminary findings in the sense that they're on an autism trait measure. They require replication, partly because they're so challenging to many of the fundamental things we think about autism and autism traits, but certainly some indicator that possibly the autistic difficulties, especially subtle autistic difficulties in females, may become evident rather later in development than they do for males. And that would fit with the widespread observation that females receive their autism diagnosis later than males. And it's also notable, there is some evidence that the complexity of the social world, for both genders, the complexity of the social world increases across late childhood and adolescence. There is some evidence that that increase is steeper for females than for males. And so what we might be seeing here is a situation whereby the social demands made on girls goes up more sharply between the age of 10 and 16 years than it does for boys on average. And as a result, produces escalating demands on girls' social skills, and thereby resulting in increasing numbers of girls struggling to meet the demands made on them by their social environment. But these are all questions to be addressed in the future. Okay, I'm conscious of the time and I want to leave time for us to have questions at the end. So I'm just going to talk briefly about a piece of research we did trying to, if you like, link the female phenotype directly to underascertainment of females with autism. So we're really asking, how does this phenotype play out diagnostically? Is there evidence is there direct evidence for an effect of the female phenotype on a girl or a woman's chance of being diagnosed or of being missed? And because there wasn't much research, or because there was no research in this area, we did a qualitative study. So instead of deriving hypotheses and testing them using statistics, we took a data-driven approach where we did in-depth interviews with autistic women who had been diagnosed late, so who'd received their diagnosis mostly in late adolescence and early adulthood, in order to kind of map the terrain here, to deepen our understanding of this phenomenon, and to generate ideas and hypotheses that could subsequently be tested in a more kind of quantitative, hypothesis-driven way. This research was led by Sarah Barjela, again a clinical psychology doctoral student, and was done in collaboration with Robin Stewart, who is an autistic woman as well as a researcher and a kind of autism consultant and sort of leader in the UK autism community, I would say. So our participants were 14 women aged 18 to 30, diagnosed, as I said, late, i.e. in adolescence or early adulthood. And we did an in-depth semi-structured interview with them. And then we analysed the data using a technique called framework analysis, which is a method of qualitative analysis that's a systematic, transparent way of organising data in order to develop themes and concepts. And I just want to pull out a few important findings that came from that about the ways in which the female autism phenotype can prevent women from being identified in a timely fashion. So one of that was the costs of camouflaging. That's illustrated by this quote here. The reward for trying to be normal was to be ignored because you were acting normal. And I look at stories online of kids who are going off the rails and I think, I should have just burnt more cars. So this woman, as she reflects back on her childhood, remembers putting a lot of effort into not seeming autistic, into not seeming to have any difficulties. And as a result, her difficulties were overlooked. And she only received an autism diagnosis much later, once she'd entered early adulthood and experienced some quite severe difficulties. Co-occurring mental health difficulties appeared to be another barrier to receiving a diagnosis. So you remember I spoke before about how autistic women are more likely to develop depression and anxiety than autistic men, although of course those conditions are also very common amongst autistic men. But this woman's had 4 or 5 years of depression and anxiety treatment, 5 different antidepressants taken to maximum dose and then back down again with no effect. Years of talking therapy. Not once did anyone suggest I had anything other than depression. So here we have a case of diagnostic overshadowing, where her depression and anxiety, if you like, masked or hid her underlying social communication difficulties and resulted in her difficulties being misunderstood and therefore not well treated. Now, another interesting sort of idea that came from this work, from our interviews with these women, was that actually another important factor in their being diagnosed late in life were the preconceptions of professionals, and in particular, not necessarily autism professionals, but professionals who were the gatekeepers to autism services, the sort of professionals who would commonly be the person who could raise concerns or could refer somebody on to an autism assessment. So one person said, I'll always remember my special needs teacher saying I'm too poor at maths to be autistic. So clearly this teacher, as it's reported here, had sort of unhelpful stereotypes, perhaps rather sort of, in quotes, Rain Man-based stereotypes about autism. And because this woman didn't fit those stereotypes, she didn't receive an autism assessment. Another participant said, when I mentioned the possibility to my psychiatric nurse, she actually laughed at me. So no, this is somebody who's engaged with mental health services, who's suffering difficulties, but people aren't noticing that they're related to autism. I asked my mum, who was a GP at the time, if she thought I was autistic, and she said, of course not. At the time, a good 10 years ago now, there just wasn't much information about how girls presented. And from what she knew, I was nothing of the sort. So when we think about the under-ascertainment of females with autism, yes, clearly the characteristics of the female autism phenotype are playing into both the bias against receiving assessment, but also perhaps the bias against actually meeting diagnostic criteria. But we also need to factor in, if you like, the environment. And in this case, the attitudes, the knowledge, the preconceptions of professionals, and specifically in the data I've just presented, sort of what I've called gatekeeping professionals, those who need to be alert to autism in order to kind of raise concerns or make appropriate referrals. And so it seems to me that an important direction for future research will be to better understand the level of knowledge and the attitudes of a range of professionals, and to see where there are gaps, and then to implement interventions to change that. Now, given the time, I'm not going to talk about these future tasks. I'm actually going to go over to questions. But before I do that, I just want to thank these collaborators, and I hope I haven't missed anybody off the list, who I've really enjoyed working with on this topic, and who've contributed enormously to much of the material that I've talked about today.
Great. Thanks very much, Dr. Mandy. At this point, I think Megan is going to open up the lines, and if folks have some questions, we're ready to have Dr. Mandy discuss them.
Yeah, thank you so much, Dr. Mandy. We definitely have a few questions, so we'll start off. I guess first, we're wondering, do we also see any instinctive mimicry of others in males with autism, or is this specific to females? If so, why? And do we know anything about the mechanisms of action here?
Yes, so that's a very helpful question. So the first thing is the evidence that's emerging both from our work, because we've designed measures of camouflaging, and also from other groups, including in particular Meng-Xuan Lai and Simon Baron-Cohen's work in this area, is that males camouflage too, but they do it on average less than females do. Yeah, so it's really important to question that, because the things we're learning about camouflaging are not just relevant to girls and women on the autism spectrum, but are also relevant to males. In terms of what the mechanisms are that underpin camouflaging, it's early days, and we haven't, we're in the process of doing studies into that, but there aren't, there's not a body of literature for me to refer to there. I mean, I would say that the key candidates, I think, that are really worth investigating are social motivation, because surely that's likely to be a driver of camouflaging. Another element may be executive function, and in particular metacognition, the ability to if you like, look out, stand outside and watch your own behavior and learn from that. And then there may well be differences in sort of more basic mechanisms of mimicry and imitation. So the science hasn't caught up yet, if you like, but those might be some ideas that I would have as to what could potentially be underpinning camouflaging amongst people on the spectrum.
Great, thank you. And then we have another question about, so this is kind of piggybacking, I guess, a little bit on that answer you just gave, but about children or adolescents with more severe symptoms of ASD. I know we talked a lot about camouflaging and social motivation in higher functioning adolescents and adults, and I'm wondering if there's been any work done maybe with kiddos who are nonverbal or minimally verbal, just about their social motivations and how their camouflaging might look different.
That's a very important question, and I mean, interestingly, I'm engaged with some work at the moment, looking into the autism literature and how representative it is of individuals who are perhaps minimally verbal or have an intellectual disability in relation to their autism. And it won't surprise perhaps many of people here today to know that those groups are really underrepresented in autism research. And I have to say that all the camouflaging research that I can think of to date has been done with people with normal range IQs and fluent language. So it's a very important question that's asked there. We need to think about this in relation to the full range of severities of presentations. What I would say is that my guess would be that there's less camouflaging going on amongst individuals who have less language and who have perhaps co-occurring intellectual disabilities. And one indicator of that could be that we find the male to female ratio amongst some individuals is much lower. So essentially, proportionally, there are more females relatively speaking, diagnosed at the kind of lower intellectual ability, less language end of the autism spectrum than amongst high functioning individuals. So that would be consistent with an idea that it's as people have sort of higher IQs and more fluent language that they, and particularly females, are using more and more camouflaging strategies. But that's a question to be investigated.
Awesome, thank you so much. And then another question that came in was kind of looping back to the beginning of your presentation when we were speaking about gender norms and kind of how children in general present differently. And the question is about whether or not there's been research done, or you think there's an impact that culture or gender norms has on diagnostic rates and then also just presentation.
Yes, I mean, I think this is one of the most fascinating things about this topic, in that clearly there's something going on, if you like, with gender norms and with sex, i.e. with biological, more biological kind of factors. So many autistic women will talk about how there are certain expectations placed upon them as females, perhaps to be more social, to be more attuned to other people's feelings, and to act in ways that are more, expected to be more kind of agreeable and so on, that are essentially coming from kind of, feminine, stereotyped feminine role, that mean that they have to learn to camouflage in order to kind of fulfill those expectations of them as a woman. So it would seem likely that our cultural gender-based expectations for people are partly driving these camouflaging behaviors, and the fact that females camouflage more than do males. And I also think that out there amongst some people, there is just a belief that autism is essentially a male disorder, and that may be contributing to the gender bias, diagnostic bias. So, for example, you might have a clinician who essentially thinks that autism is a boy disorder, comes across a girl, maybe a 9-year-old girl, fluent language, in mainstream education, really struggling socially, only has one friend, very anxious, and they may well be more likely to think, okay, this is a girl who's got, let's say, social anxiety difficulties, and let's go in for some CBT. Whereas if they were presented with a boy in a similar situation, they might be much more likely to suspect autism.
All right, thank you so much. I think we have some more questions, but I'm not thinking we're going to have time to get those to today. We just want to thank Dr. Mandy so much. This was really informative and just so interesting. And thank you everyone for attending. We really appreciate it. Look out for our November topic in the bi-weekly updates. And if you have any questions, you can feel free to email us, definitely. So thank you so much, everyone. And thank you again, Dr. Mandy. This was really wonderful.
Well, thank you for having me along.
Thanks again. Everyone, enjoy your week. Bye now.
Cheers. Bye, everyone.